Welcome to this explainer. We're jumping right into the massive, often totally invisible engine that keeps our global medical systems actually running, and that's the healthcare distributors industry. We're going to dive deep into the immense macroeconomic pressures driving this industry today, and crucially, how these companies are adapting at the micro level just to survive. If you've ever stopped to wonder how vital medications and complex medical devices actually make their way to hospitals, to pharmacies, and ultimately to you, especially in an era of intense cost-cutting, well, you're in the right place. Here's our roadmap for today. We'll be looking at 1. Macro drivers. 2. Fleet fuel and logistics. 3. Product safety and counterfeits. 4. Product life cycle. And 5. Business ethics.
Section 1. Macro drivers.
Okay. To really understand the immense pressure on this industry, we have to start with the macro foundation. The absolute bedrock of market demand comes down to 4 massive, intertwined forces: insurance rates, overall pharmaceutical spending, illness trends, and changing demographics. Let's think about how these interact for a second. As populations get older globally, and as specific chronic illnesses become way more prevalent, the raw demand for care absolutely skyrockets. There are literally just more people needing more treatments. But at the exact same time, payers, insurers, and governments are desperately trying to rein in insurance rates and curb overall pharmaceutical spending. So this creates a massive structural squeeze. Distributors are caught right in the middle. They have to move more product faster and cheaper while finding efficiencies in absolutely every single corner of their operations.
It's kind of wild to think about the sheer massive scale of what's being moved out there. To even begin to measure their sustainability and efficiency under all that macro pressure, the industry relies on some core activity metrics, namely the raw number of pharmaceutical units and medical devices sold. Framing this as a quantitative number by product category gives these companies an absolutely crucial baseline to normalize their data. It essentially gives them a way to say, okay, if demographic shifts mean we're moving 100 million more units this year, how does that actually impact our physical footprint?
Section 2. Fleet, fuel, and logistics.
So how do you actually move that astronomical volume of product efficiently, especially with climate change and wildly fluctuating fuel prices? Well, the game changer here is mastering something called payload fuel economy. You see, these distributors are incredibly exposed to fuel costs. To manage this, they measure the total liters of fuel consumed divided by revenue ton kilometers, or RTK. Now, RTK is calculated by multiplying the distance the goods travel by the metric tons of the actual payload carried. And the really fascinating part? This completely excludes the weight of the vehicle itself. It's strictly measuring fuel efficiency against the actual weight of the paid tonnage being transported, whether that's on the road, the rails, the ocean, or in the air.
To combat those relentless macroeconomic cost pressures we just talked about, distributors can't just rely on doing things the old way. They have to implement some highly specific, aggressive strategies to shrink the environmental and financial impact of their massive networks. We're talking major fleet upgrades for better fuel efficiency, jumping into alternative or renewable fuels, highly optimized logistics routing, and super strict idling reduction programs. Because look, if your fleet is traveling millions of miles a year, cutting down just a tiny fraction of unnecessary mileage or idling time isn't just a nice PR talking point anymore. It is literally an essential survival tactic.
Section 3. Product safety and counterfeits. Now, once you've figured out how to move all that product efficiently, you immediately face another massive operational risk. How do you guarantee that the medicine is actually real? This number is honestly staggering. 10%. That is the World Health Organization's estimate for the amount of counterfeit drugs in the pharmaceutical supply chains of low and middle-income countries. And let's be clear, it's a huge risk in developed economies too. This applies to both brand name and generic products. Counterfeit could mean the drug lacks the active ingredient, has the wrong ingredient entirely, or just uses fake packaging. The added costs of navigating regulations to prevent this are immense.
To stop catastrophic safety failures dead in their tracks, distributors have to be absolutely meticulous. They maintain airtight traceability from the second a product enters the chain. They track the chemical composition, the production date, the processing history, the whole shebang. They do this using advanced tech like RFID tagging and barcode systems. But it also takes rigorous human processes, right? Deep vendor inspections, instant alert systems for hospitals, purchasing directly from manufacturers whenever they can, and demanding strict third-party certifications.
Section 4. Product Lifecycle.
All right, so the genuine, safe product has reached the end user, but the distributor's job actually doesn't end there. They have this massive opportunity to reduce waste through packaging. Packaging is broken down into 3 levels:
Primary packaging is in direct contact with the product, so think of the blister pack actually holding the pills. Secondary packaging is the box holding those blister packs, and tertiary packaging is the bulk material used for transport, like those giant cardboard boxes and wooden pallets. Distributors usually focus heavily on that tertiary packaging, really pushing for recycled content and reusable shipping containers to drive down costs and improve sustainability.
Another really important efficiency metric here is product takeback. Distributors track the exact weight, in metric tons, of products they successfully accept for takeback, broken down by drugs versus devices. But here's the catch, and it's a big one. This metric only counts materials that are successfully reused, refurbished, recycled, or donated. If it ultimately goes into the trash, it literally doesn't count. It's a remarkably strict measure that forces these companies to run genuine end-of-life programs rather than just chucking things in a landfill.
Section 5. Business Ethics.
Managing this entire massive web, from those huge macro demands all the way down to the cardboard boxes, takes an absolutely ironclad commitment to business ethics. Because this industry handles highly regulated, life-saving products, distributors must fiercely enforce their codes of conduct. We're talking strict rules around fair competition, how they gather intelligence, how they interact with government officials, and ensuring their marketing claims are rock solid. Violations here aren't just a slap on the wrist. They can lead to massive monetary losses from civil judgments or even criminal actions. So compliance committees aren't just for show. They are mandatory to protect the company and the public.
So let's bring it all together. We started by looking at those powerful macro drivers, our aging demographics, shifting illness trends, and that intense, constant demand to reduce insurance and pharmaceutical costs. When you weigh those massive external forces against the daily operational risks of fuel logistics, counterfeit threats, and ethical compliance, it leaves us with a pretty provocative thought. As global demographics shift and illness trends keep rising, can healthcare distributors afford to ignore the true cost of their supply chains? The answer for sure is no. Our future healthcare systems kind of rely on them getting this exactly right. Thanks so much for joining me for this explainer, and we'll catch you next time.